I'm Shilpa Padilla, and I'm a breast cancer surgeon at Mount Carmel Medical Group. I chose breast cancer specifically because of the great survival rate. Unfortunately, I had to deal with cancer in my life. My father was diagnosed with liver cancer when I was young and passed away soon after we found out. And so from that day forward, I knew that I wanted to deal with patients with cancer because I knew what it was like to be on the other side. And so I picked breast cancer specifically because I got to create relationships with patients. I got to watch them grow. I got to watch their children grow. And the survival rate is amazing that it really is truly an obstacle and not an end-of-life point for a lot of women. Watching people grow. That is the most rewarding part. Cancer is such a scary diagnosis that a lot of people think that it is their end-of-life point, and to watch them return to who they are is the thing that makes me the happiest, and I'm so blessed to be part of that. My patient care philosophy is involving the patient in the decision-making. Gone are the days when we tell people that this is what you do and you just do it because a doctor said so. Especially in breast cancer, it's so many different treatments and it's hard to understand everything that I really want to make it clear that we are on the same page and that you are making a decision that is best in your heart. My biggest pet peeve is women that make decisions out of fear, or even men that make decisions out of fear. Never make good decisions when you make them that way. So if we make the decision collaboratively and you understand what I'm saying, that's the best thing. So I always want women to know that that's the most important, that you are comfortable in your heart with what decision that you make. The best advice that I could give a patient is to follow our national standards and get your mammogram starting at age 40 every year. It's the best way to detect breast cancer, especially in its early stages when it can be an obstacle and not an end-of-life point. I think the most memorable piece of advice that I have heard is to be yourself. When I started and decided I wanted to do general surgery, I was told that I was not the typical general surgeon, that I wasn't a man and that I wasn't strong enough and I wasn't big enough and that I didn't have a strong enough voice. And I had one of my mentors tell me that it didn't matter who I was inside is what mattered. And so what I would say is the best advice is no matter what you go through, no matter what obstacles, no matter what someone puts you through, be true to yourself and the best outcome will always come if you do that. If you want to learn more about me or Mount Carmel Medical Group, go to mountcarmelmedicalgroup.com.